Joining me now is Dr. Christopher Labos, epidemiologist and cardiologist. Thanks so much for making the time, Dr. Labos. Let's just start out with, monkeypox and how that has developed over the past weeks and even the past couple of months. What can people do to protect themselves from this, and how worried are you that this could become as severe as other viruses such as COVID-19?
So it's probably not going to become as severe as COVID-19 because it's not as infectious. It doesn't spread as easily from person to person. So this isn't something that you're going to catch from somebody at the grocery store. But we have seen a significant increase in cases globally, whereas, monkeypox outbreaks used to be extremely rare and extremely limited in size. So how worried should people be? I think they need to be aware of the problem. And what we need to do as a public health response is vaccinate high-risk groups. And those are predominantly men who have sex with men, because that's the community in whom the virus has been spreading. But otherwise, people just need to be careful. If somebody has symptoms that could be monkeypox, they need to get tested. They need to isolate. If they can be diagnosed early, they can get the vaccine as a preventative measure. And there are treatments available. And if we can limit the spread of monkeypox from person to person, we can contain it, at least in Canada. And then long-term, the solution is going to be controlling it at its source, which means, parts of Central and Western Africa where the disease is endemic, and really pouring in resources into the countries where it's needed. And what we have to guard against is complacency, because it's going to be very easy once cases get under control here in Canada to stop caring about this issue, and that would be the wrong thing to do. We need to keep caring about monkeypox even when it's not a direct threat to us living here in this country.
And when you look at monkeypox and the way that it takes for people to recover from it, obviously there's concern from elected officials across the country that it takes longer to recover than, say, other viruses such as COVID-19. Some people saying it could take up to a few weeks in order to recover, and therefore some elected officials are calling for additional paid sick days in order to deal with recovering from the virus. So, I mean, I guess how beneficial would it be to have things like additional paid sick days in order to allow people to have enough time to recover from monkeypox?
I think it would be very necessary. I mean, I think we saw this during COVID. If you don't want people to show up to work sick, you have to have paid sick leave. And because monkeypox, you can be infectious for a fairly extended period of time when you still have active lesions. I mean, you need to stay home. You can't risk infecting other people. That's how outbreaks happen. So people need to stay home when they're sick. And, that's what paid sick leave is for. So I think we need to realize that if we want to contain the spread of illnesses, whether it's COVID, the flu, or monkeypox, or what have you, you need to pay people when they're sick, because there really is no other alternative. The alternative is they show up to work sick and then infect everybody in their workplace.
Okay, Dr. Christopher Labos, cardiologist and epidemiologist, thanks so much for your time today. Really appreciate it.
My pleasure. You take care.